Hi, I've just joined. I'll just be here if you have any problems or anything. If you just need me, just shout and I'll be hanging around on the link.
Hi, I'm just checking all the technical stuff. It looks like we're all good. So,
Perfect. Okay, thanks.
again,
Sounds good.
Hello, lovelies. I am running all the technical stuff today. Just starting now. So if you could let me know in the chat wherever you are that you can like hear me, that would be good. That you can see me, that would also be really good. Because there are lots of things going on. And well, yes, there's just lots of things going on. It's really nice to know that I'm not talking to myself. So the plan is for this to be streaming in lots of different locations. So please, good, people can hear me on YouTube. Can people hear me on Facebook? Let's go live on Instagram. Right, good. People can hear us. So we're not going to start early. We're not going to start until 1:15, because that is the time that I said we were going to start. But you know, I'm a teacher and we're doing medics today. We just have the habit of turning up early for things. It is a bad habit, but we just do it. We just turn up early for stuff. So here we all are, but I promise we won't start the actual interesting stuff until 1:15. So I get asked lots and lots of questions by students about things that I don't necessarily know the answer to. So lots and lots of things about personal statements, lots of things about applying for medicine. So I thought I would draft in some experts for you. So we have the lovely people over at Medics and Me going to be answering your questions, doing you a nice little session on how to write your personal statement for medicine. So if you've got any questions, drop them in the chat and then I'll feed them through. The Medics and Me do absolutely fantastic stuff, helping people who, you know, don't necessarily get all the support that other schools get. Some schools get lots of support for writing personal statements, writing medicine stuff. Some schools don't. So Medics and Me will help you with loads and loads of stuff like that. If you've got anything about personal statements, if you've got anything about UCAT or places to apply, then they are the people to go and ask about this. I can do things like help you pass your A-levels, but it is not just about passing your A-levels. There's lots and lots of other stuff involved as well. So I think we have all the technical bits running. We can definitely just give me a couple of thumbs up in the chat so I know just not one person can hear me. That would be lovely over on YouTube. I think we're good on Facebook as well. And we appear to be all right everywhere else. Good. Right, so everything is going really well. So we've got 3 minutes before we start. We're not going to start early because I know some people are just going to be waiting until 1:15 to turn up, or even like, you know, 20 past to turn up. So thank you for the thumbs up. Yes, good. Always good to know that I'm not talking to myself. This will be the time to get any questions into the chat so that what I can do is like sort out the questions into, you know, batches. And then if anything doesn't get answered in the presentation, I'm sure everything will be answered in the presentation. But if anything doesn't get asked, then I can feed all of those through instead of kind of like bombarding all of the time. So drop any questions in the chat for me. That will be lovely, and we can sort all of those out. What I can see, we've got quite a few people here. That is absolutely lovely. Medics and Me, do you want to do a tiny introduction before we start the actual presentation?
Yeah, perfect. So my name is Quiva. I know you may be able to see my name on the screen as Frank. I'm not Frank. I'm Quiva. I'm a third year medical student at the University of Nottingham. I am the Director of Education for Medics and Me, so overseeing organising a lot of different events, including this one. And I've been with Medics and Me for a few years now. I've been a mentor in some of our partner schools, helping individual students with their medical applications. I've been a schools lead, and now I'm directing education for the charity, which is a nationwide charity. So hopefully this evening will be helpful for you. A bit of a crash course on the personal statement, how to write it for medicine, and we'll be taking questions at the end or as they come through. Amy, do you want to introduce yourself as well?
Yeah, so I'm Amy. I'm the events lead for Medics and Me. So similar, I kind of oversee lots of the events that we do. So that's like our personal statement talks like this one, but we also do lots of meet the doctor sessions. So if you are interested in learning a little bit more about medicine or seeing some role models for some doctors, we have lots of really interesting talks. They're all advertised on our website or on our Instagram. So yeah, I hope you'll have a really good time.
Lovely, thank you. And it is now 1:15, so we can start. I'll pass you over. Thank you very much.
Fantastic. I'll just share my screen. We've got some slides, and if someone can let me know when you can see them, that would be great.
Yeah, they're visible.
Fantastic. Okay, so hi everyone. Welcome to our personal statement workshop with Primrose Kitten. We're really excited to be having this joint event tonight. And this is, so as I was saying, I'm from Medics and Me. These are just some pictures of our social medias. We're most active on Instagram and TikTok. If you want to have a look afterwards, we've also got a website, which I'll talk a bit about in a minute. And we are a widening access charity for medicine. So we're helping students from every background to have equal opportunities in terms of support for their applications to medicine. I've got a QR code for our website here, but it's just medicsandme.com. We run lots of different events, and these include workshops and webinars like tonight, PBL sessions, that's problem-based learning sessions, where we talk about some things like communication and things that are really important for medicine applications. And we have events like Meet the Doctor, which is kind of like an opportunity to virtually meet with a doctor, and we've got some examples there of our recent and upcoming Meet the Doctor sessions. They tend to be very popular because it's quite difficult to get work experience, as I'm sure you'll all be aware. So having the opportunity to attend a webinar run by a practicing doctor and aimed at people applying to medicine is something that is very popular among the people who come to our events. So the plan for today, for this evening, is to give you all an overview of the personal statement. We're going to have a look at the structure of the personal statement, what to include, some do's and don'ts, how to reflect on experience, and I'm going to show you some examples from our fantastic Medics and Me team. So everyone working on the Medics and Me team is either currently a medical student or a doctor. So they have all successfully gone through the process of applying to medical school and are now helping out, helping others with their applications. What I will say at this stage, and I'll say it again later, is that in sharing examples, we're sharing examples in good faith because we know it can be really difficult to find examples of good personal statements, but we ask that you don't copy anything that we share with you, not only because it's the wrong thing to do, but also because UCAS do use an anti-plagiarism software. So I'm sure that won't be an issue anyway, but just as a disclaimer, that these are examples from personal statements that our mentors have submitted as part of their UCAS applications in the past. So we'd ask you not to copy directly anything that we share. So how to make the most of this session? We'd always advise with all of our sessions that you engage in any activities included, take notes during the session, and document your personal reflections. So as I'm talking, if there's anything that you maybe haven't thought of before, or when I'm talking about how to reflect on an experience, if there's anything new to you, make a note of it and link it to any particular experiences that you've had, so personal reflections. And that will be helpful not only for your personal statement, but also in preparing you for your interview. So a quick overview of the personal statement, and this is for 2025 entry. You've got a 4,000 character limit, including spaces, which is about 47 lines. And this is your opportunity to demonstrate your motivation to apply to medicine. So you need to be showing why you're suitable, why you want to study medicine, and also show an understanding of the career. So medical schools often want to see an insight into the job that's involved as a doctor once you graduate. Each university uses the personal statement differently, and we'll talk a bit more about that in a minute. But the main thing that I want you to take away from this is that this is an opportunity. It is not an obstacle. It's not this horrible thing that people hate doing. It is an opportunity for you to show these medical schools everything that you have to offer. Show them why you are the ideal candidate, why you are suitable, and that you are who they want attending their medical school. And as I'm sure a lot of you will be aware, anyone applying to medicine, no matter where you're applying, it is the early UCAS deadline. So that's the 15th of October this year, giving you just under 2 weeks, which is plenty of time to write a fantastic personal statement. So how is the personal statement used by universities? Every university uses it differently. I've taken a few examples here. I've picked these completely randomly, just in terms of showing you the spectrum of the different ways that it's used. I've gotten all information here from the respective universities' websites, and if you check the website for whatever university you are applying to, they should also have it listed there how they use their personal statement. So Brighton and Sussex Medical School don't use or read the personal statement whatsoever. Queen's University Belfast needs you to state specifically that you want to study medicine and that you want a career in medicine, but they don't score it as part of their scoring process to decide who gets an interview. Queen Mary University London and Aberdeen, they both say that if you get an interview, they can base some of the questions in your interview on your personal statement. Glasgow and King's College London both use it in their screening process or their shortlisting selection process for who gets an interview. Bristol use it to decide between candidates with the same interview and UCAT score. So Bristol score their interviews and they score your UCAT. They assign you a certain number of points. And if there is a situation where there's the same points for interview and for UCAT between candidates, then that's when they use the personal statement. And similarly, Leicester use it to decide between borderline candidates. That's how they describe it. So there's a real spectrum from not using it all to it making part of your interview and being part of the selection process. So I would advise that once you've decided where you want to apply, and most people will strategically apply based on UCAT score and maybe your GCSEs and your predicted A levels, things like that. But make sure that you double check how they use the personal statement wherever you're applying. And as I said, that information is usually on the university's website. So the structure of the personal statement, what should you include in your personal statement? Structure-wise, intro, body, and conclusion, pretty similar to any piece of writing you've ever done before in terms of structure. So in the intro, this is your opening statement saying why you want to study medicine. And I'll talk a bit more specifically about intros in a minute, but it's really key that you immediately get across why medicine. You should be answering that question in that first sentence. 4,000 characters is not very many, so the intro should be quite short. You want to save the bulk of your characters for the body and explaining why you're suitable, etc. So the body, as I said before, why you're a suitable candidate, all your best qualities, all your skills, all the fantastic things about you, why these medical schools should want you as a medical student. Your body should also include an insight into medicine as a career. So be that if you've had work experience, if you've done some volunteering, if you've done some wider reading, maybe you've read a book that was written by a doctor, or if you've done any extracurriculars that have given you an insight into the career that is being a doctor. And it's really important to be linking all of this back to a career in medicine as you're going throughout the personal statement. And then the conclusion, similar to the introduction, they tend to be quite short because you'll use the bulk of your characters and the body. With the conclusion, you want to tie together what you've said, really strong statement, definitive, and committing to that career in medicine. So getting started, this is a really difficult part and it's a part that a lot of people struggle with. So getting started, what we would advise that you do to get started is get out a piece of paper and make a plan first. So on this piece of paper, you can do it as a mind map, spider diagram, bullet points, however you want to structure it. Just get out a piece of pen and paper and jot this down. Make a plan of what you want to include. So that can be work experience, volunteering experience, books, hobbies, whatever you want to include, get that all on a piece of paper. And then from those experiences, pick a learning moment that stands out. So maybe it was a particular interaction you observed on work experience. Maybe it was a particular match you played as part of a sporting team, or any number of examples. Start picking out moments that stand out to you from these experiences, because, and I'll develop this later on in this talk, but it's better to specifically talk about learning moments from experiences than it is to just generally and passively mention an experience that you've had. So start picking moments that you learn something from as part of these experiences. And finally, on that page, you need to write down any buzzwords or characteristics that you want to include. So buzzwords might include empathy, teamwork, leadership, things like that. Things that will stand out off the page to someone reading your personal statement that make you look absolutely fantastic. And a really important thing to note for anyone who hasn't started yet, the opening sentence absolutely does need to grab the attention of the reader, but it doesn't have to be the first sentence you write. So don't be waiting around to get the perfect first sentence to get started. Just get going. Get out that piece of paper, get planning, and get writing. Even start writing your body. You don't have to start by writing the first sentence, and it can be a really easy way to fall into procrastinating for far too long, to be waiting for the perfect opening. So just get going is the message to take away from that. Now I'm going to share with you some examples of introductions, and as I said at the start, all examples I'm sharing are coming from people who are mentoring with Medics and Me, so they're all either currently medical students or doctors. So they've all successfully gone through this application process and have very kindly agreed to share their personal statements that got them to that point. So undergoing lateral ankle ligament reconstruction was crucial first-hand experience of the remarkable difference a doctor can make, as it allowed me to continue sport, improve my quality of life, and sparked my interest in a career in medicine. Furthermore, my neurosciences degree has reinforced my passion, given me maturity alongside essential physiology and pharmacology experience. So that's an example from someone who is a graduate, so they've done an undergrad degree and they were applying to graduate entry medicine. Another example, I want to be a part of the generation of doctors which prevents obesity being the leading risk factor for many diseases. So again, as I was saying, this one's quite short, but you'll see from both of these and from the other examples, they immediately answer the question, why medicine? Straight away, you know exactly what they're talking about, and they're answering the question why they want to study medicine. Next example, understanding the building blocks of the human body, how to maintain its efficiency, and how to restore its functioning after it fails is what entices me about medicine. Another example, my decision to study medicine was not a beautiful childhood dream or an eye-opening experience, rather a series of small moments that have captivated me. From childhood accidents which I experienced, healthcare in different countries, to never-ending curiosity in class when I learn about the complexity of the brain and biology, I have been fascinated to study further. So you'll see from all of these examples, they're all completely different. One is a graduate who's talking about their undergrad degree. One is someone talking about the future and their vision for why they want to be involved in medicine on a larger scale. One is talking about specifically what things has enticed them to pursue a career in medicine. And one is saying that it's not been a specific moment, or rather a series of moments. And then in their personal statement, they go on to discuss those further. But what I want to show you here is that there's no one correct way to start a personal statement. There are loads of ways to do it, lots of ways to very effectively open it and get across your point. Most important thing being that you're answering that question, why medicine, from the get-go. Don't waste a single character. Straight away, you should be demonstrating why you want to study medicine. So I'm going to get you to do a quick activity at this point. I'm going to put on a 5-minute timer, but what I want you to do is, and I know some people watching here will have already started their personal statement, but I want you to do this anyway, and you can take this then to go back and edit your personal statement. Get out that piece of paper and start that plan. So I want you to start by putting 5 buzzwords, personal traits. So as I was saying, things like empathy, teamwork, leadership, there's a whole list of them. Things that you think medical schools are looking for and examples of when you've shown this. So, and also remembering that I was saying picking moments from experiences rather than talking about them generally is also really important. So I'll give 5 minutes from now. And as we're going, if people want to share in the chat, just examples of buzzwords, you don't have to put your whole learning moment experiences into the chat, but it'd be great if we could get people sharing a few of the buzzwords that come to mind for them. And then we can give some other people maybe some inspiration there as well. Yeah, so someone shared teamwork is an example of a buzzword. That's a really good one. And also something that medical schools will be looking for. So really good if you can display an example of a time that you've shown teamwork. Someone else has said compassion, really good. So again, thinking about traits that you'd want in a doctor. Being compassionate is a really, really important part of the job. And really important that medical schools can see in you that you have those characteristics. Someone said empathy, really good. And also, as you're thinking of these buzzwords, make sure that you're thinking of examples from experiences that you could talk about, both in a personal statement or potentially in an interview down the line. Think about experiences you've had about when you have shown teamwork, when you have shown compassion, when you've shown empathy, all of these buzzwords. Passion, really good. Medical schools absolutely want to see that you are passionate about this job. Because it is a big commitment to undertake a medical degree and want to go on to have a career in medicine. So showing passion is really, really important for that. Understanding, fantastic. Dedication, absolutely. It's by no means an easy thing to undertake, and they want to see that you are dedicated to both your studies and then to your job beyond that in the future. Wanting to help young children, yeah. So that could be maybe you have a specific example of that, which would be great, of an experience you've had, and that can show lots of different skills. Because working with young children, a lot of the time, communication skills will be really important there. So that could be something you could talk about from that experience. You've got 2 more minutes, so that everyone can get thinking about buzzwords and traits that they're going to talk about. Critical thinking, yeah, that's a really good one. And that's something that within the medical degree, medical schools will get you to do a lot of, and they'll have you participating in workshops and even when you're on placement. Very relevant as well. Perseverance, yeah, absolutely. Lots of really good examples there coming through. Well done. And as I was saying, even if you've started your personal statement already, I would still encourage you to take part in this activity. And then after the workshop, Go back and look at your personal statement. See, have you included buzzwords? Can you identify buzzwords in your personal statement that are going to stand out? Have you talked about particular learning moments from experiences that you've mentioned in your personal statement? Okay, so that's 5 minutes, and we'll carry on, but make sure that you keep that so that you have that to come back to and build on. And now I'm going to give you some examples of buzzwords. Now, these examples, I've given an example of a few different buzzwords that you might include, and then I've thought of an example of an experience or a time where you may have shown that particular trait. I've just made up these examples based on kind of common experiences that people who are applying to medicine have had, but you can give absolutely any example you want whatsoever, and this is not by any means an exhaustive list. There are hundreds of buzzwords that you could include. This is just a small selection. So first of all, empathy, that might have been from volunteering at a local nursing home once a week that you're displaying empathy. Teamwork or multidisciplinary team, if you've had work experience with other healthcare professionals, maybe on work experience, you got to see how a nurse or a physio worked within the multidisciplinary team. Leadership, maybe if you captained a sports team or if you were on the student council in school. Good communication, for example, a summer job working in retail or if you've worked with children. Learning from making a mistake, for example, taking feedback on schoolwork. Resilience, example of reapplying to medicine if you didn't get a place the first time round. Compassion, for example, if you've observed a doctor delivering bad news on work experience, maybe they showed compassion. Time management, for example, balancing school with extracurriculars, if you're talking about either of those things in your personal statement. And patient-centered care, if you've maybe read a book that was written by a doctor and that was something that stood out to you as the patient-centered care. So as I said, just a few examples of buzzwords and experiences that might demonstrate them. But there's no such thing as a wrong answer, and there's hundreds of examples of buzzwords and experiences that you could include in your personal statement. Next, we're going to run through some do's and don'ts of the personal statement. So this is from, as a mentor with Medics and Me, we review and give feedback on statements for our students every year, and these are just some of the common do's and don'ts that our mentors advise in general based on that experience. So first do, show understanding and insight into the job of a doctor. Medical schools want to see that you know what you're getting yourself into. They don't want to see that you've watched 20 seasons of Grey's Anatomy and decided this is for you. They need to see that you've gone above and beyond to get an insight into the job of a doctor, and really importantly, that you know what you're signing up for. And next would be to reflect on experiences. So highlighting what you've learned and linking it to medicine. And that's really, really important. It is much, much more valuable for you to say, I had this experience, this is what I learned, and then this is how that's going to be relevant to a future career in medicine, rather than just saying, I did this, full stop. You really need to reflect on the experience by showing what you learned and linking that to medicine. And that's something that a lot of people forget to do, but it's really important. Show motivation and dedication to a career in medicine. So that can be through work experience, volunteering, further reading, loads of ways you can do this. But it's really important that you seem enthusiastic about a career in medicine. Share your personal and unique experiences that have led you to apply to medical school. So this is a personal statement. It's meant to be personal, and it's really important that you have unique anecdotes and unique experiences that have led you to apply to medical school, and that you show that and explain your why. Mentioning both academic achievements and personal hobbies that highlight your suitability. So it's easy to just focus on, the academic side of things, but including hobbies and things like that have plenty of traits. For example, a sports team can show teamwork, leadership, loads of things. That's a way to also include hobbies, which highlights that you have a work-life balance. And that's something really, really important, because burnout is a big topic at the moment among both medical students and doctors. So if you can show that you're not only strong academically, but that you have hobbies that you're learning really important traits from, like teamwork and leadership, but that you also have a work-life balance. That's a real green flag for medical schools in a potential applicant. Demonstrate your desirable traits and achievements. So as I was saying at the very beginning, this is your chance to show them that you are absolutely fantastic and that they want you as a medical student. Show them how fantastic you are and how that's going to translate into you being a great doctor. Be concise, because every word counts, and really crucially, quality over quantity. 4,000 characters is not a lot, and you will realize that once you've done a draft of a personal statement, you will almost always end up having to cut things out. So be as concise as you can and get good quality things in there over quantity. Next, moving on to some don'ts. Don't use cliches, especially without developing the point that you're making or giving examples. And we'll come back to that later, but an example of "I want to help people" is one that we tend to advise you to avoid, because although it's a lovely sentiment, if you just say "I want to help people" and don't develop that point or give any examples, that's not going to do you any favors. Don't list characteristics without giving examples of how you show them. So it can be really tempting to try to get as much as you can into this personal statement, into this 4,000 characters. But don't list characteristic. Don't say "I am a dedicated, hardworking, empathetic," and just list 5 different adjectives without giving any examples, because that's not beneficial. It would be much more beneficial to give 1 or 2 characteristics and show how that applies to you. Show why you're empathetic. Give examples. Don't repeat yourself, particularly in the conclusion. So unlike an essay, you're not repeating everything you've said in the conclusion. And repeating yourself is just going to end up being a waste of characters. You only have space to say everything once in this personal statement. Don't focus on specific medical knowledge when talking about work experience, because there are no bonus points for medical jargon. So this is something that we actually see fairly commonly in anyone that's been lucky enough to get work experience, that they use a lot of characters trying to describe a medical procedure that they saw, when medical schools aren't looking for you to know the first 10 steps into a surgery that you observed. They want to know that you have learned about the characteristics and traits that they're looking for in a doctor, and that you understand the job that a doctor has. So don't waste characters describing specific medical knowledge. Medical school's job, once you're in, is for them to teach you that. It's much more difficult for them to teach you characteristics, so that's what they're looking for in their applicants. Don't lie, and not only because it's wrong, but because, as we mentioned at the beginning, in some places you'll have to answer questions based on your personal statement at interview, and you do not want to be caught out in a lie there. Don't belittle other healthcare professionals. So if you've been lucky enough to get work experience and you've maybe observed another healthcare professional on work experience in their job and their things that they were doing on whatever day you observed, be really careful that you're respectful of everyone, and not belittling anyone else in an attempt to say that you want to do medicine specifically, because in every healthcare setting we work as a team, and the multidisciplinary team, which involves everyone from the admin, nurses, physios, doctors. We need everyone on that team to work together, and there is no one on that team that we could do without. So be really careful that you're respectful of everyone. And don't copy anyone else's work. So as I mentioned at the very beginning, UCAS do use anti-plagiarism software. So as well as it being a wrong thing to do, it's really important, because you will be caught out if you are copying someone else's work. And leading on from the don'ts, these are some common mistakes. So pitfalls that we see lots of students falling into every year. And I'm going to share these with you so that as you're reading over your personal statement, you can make sure that you haven't fallen into any of these common mistakes. Not being specific about your reason for wanting to study medicine. So it can be easy to accidentally end up being quite vague in your personal statement, because 4,000 characters can limit you. But it's really important that you are specific in your reading for wanting to study medicine. There should be no doubt in the person reading your personal statement's mind that this is, you are absolute in this decision, and that this is what you want to do. Not linking how a personality trait or experience will be relevant to a career in medicine. So this comes back to your reflection. You're both reflecting on what you learned and how that's relevant to medicine. If you talk about an experience, say what you learned, that's great, but you need to remember to link that back to a career in medicine. Why will that make you a good medical student? Why will that make you a good doctor? Why is that important? Why are you mentioning that in your personal statement? Don't ramble or waffle off on a tangent about a relevant experience. And again, you'd be surprised at how easy it is for this to happen. But as I said, quality over quantity. So make sure that you're not rambling or waffling. Listing extracurriculars without saying they've helped you. So in the don'ts, we mentioned don't list adjectives and don't list personal traits. A really common mistake is when people are trying to squeeze in as much as they can, that they just list, I was on the basketball team and I was on the student council and I was on XYZ, without saying what you've learned or how they've helped you. So this comes back to reflecting on your experiences effectively. Only including positive things and not showing an understanding of the challenges associated with the job. So it is a difficult job, and there are unglamorous aspects of it. And the medical school reading your personal statement, they want to see that you're not naive. They want to see that you have done your research into it, you understand what you're getting yourself into, and you still want to apply to medicine, even though you know that it is not all sunshine and rainbows all the time. Very long sentences. This is something really, really common. And what I say to all of my mentees, anyone that I've helped giving feedback on a personal statement to, if the sentence is too long for you to read in one breath, it's probably too long. So if you are reading a sentence out loud, you should be able to read it in one breath. If you're having to stop and take another breath a couple of times, your sentence is too long. And very long sentences, that just leads to the person who's reading your personal statement losing their place entirely. And you may be making a really good point, but you mightn't get that across because if the sentence is too long, it can be difficult to follow. So we mentioned earlier avoiding cliches. I'm going to give you a few examples here from our mentors, from their personal statements that they submitted when they were applying to medicine, of how to rephrase some common cliches. And we're not saying that there's anything wrong with wanting to help people or wanting to be a lifelong learner. They're actually really desirable traits in a potential medical student and doctor. But what you need to be careful about is how you phrase that. So I'm going to give you some examples here of better ways to say these things. So instead of I want to be a lifelong learner, this person said, I gained insights into life in the medical profession, learning that the journey into medicine is difficult, but it is also thrilling to learn something new every day and develop into a better version of yourself while constantly reflecting the core NHS values. Instead of saying I want to help people, this book gave me an insight into the realities of being a doctor and made me eager to embark on my journey into medicine to support those most vulnerable. So that person had been previously talking about a book that they read that was written by a doctor. And instead of I want to help people, they've linked that really nicely there and said this instead. Instead of I want to save lives. After this experience, I took a particular interest in the bias in biology briefing by the British Heart Foundation, highlighting the gender gap in the diagnosis and treatment of cardiac conditions in women. I was further inspired by this to become certified in CPR. I am absolute in my decision to make a difference and in advancing well-being and equality of care. This person had talked about work experience shadowing a GP who found a heart murmur on examination, and instead of saying I want to save lives, they've really nicely taken that experience and worded this in a better way. And finally, medicine is a combination of science and caring for patients. Could be rephrased as, my experiences at the hospital have both reinforced to me the importance of holistic care and shown me the value of combining medical research with patient contact to optimize the quality of care given. So next I'm going to talk a bit about work experience. If you have work experience, absolutely this is something that you need to include in your personal statement. However, demonstrating what you have learned is absolutely the most important thing. So there's no point in mentioning that you had work experience in a hospital or a GP or wherever you had it if you don't also say what you learned and show reflection. That is the most important part of mentioning work experience. Really important also that you don't break confidentiality if you have had work experience. So that means no naming patients or no saying anything that could potentially identify a patient, because you, both as a medical student and a doctor, will be expected to uphold confidentiality, and you need to demonstrate that you understand the importance of that from day one. And if you don't have clinical work experience, no panic, that's absolutely fine. Think of other experiences you've had that demonstrate the traits of a good medical student and doctor. So that could be playing on a sports team, hobbies, extracurriculars, volunteer work. There's an endless list of ways that you can demonstrate how suitable you are as a candidate. Now I'm going to talk about reflection. So this is both relevant to work experience, extracurriculars. It's pretty much relevant to everything that you'll be writing in your personal statement. And it is, in my opinion, the most important aspect of writing a personal statement. Reflection is what distinguishes a strong from a weak candidate. You have to reflect on every experience you mention. And there's two parts to that. You need to show how it was beneficial, what you learned, and then you also need to link it to medicine. And that will make you a really strong candidate. If you can show for any experience you mention what you learned and how that's relevant to medicine, that's absolutely fantastic. Reflection makes your experience unique and authentic to the reader, which is really important. And both in a personal statement and interview situation, it will make you stand out. So, basic structure of reflecting, you talk about the experience, particular skill or moment that you observed, and then reflect on why that's important. And I'm going to go through a structure for how to reflect on the next slide. So how to reflect. Describe the situation or experience. Describe why it stands out to you or what in particular resonated with you. So you're picking one thing that stood out. How did this make you feel, or what did you realize in this moment? And then looking to the future, how will this affect you as a doctor and medical student? Really important point is that you need to keep this concise. It's really easy to ramble when you're describing experiences. And another thing is the STAR framework. So I don't actually know where this originated from, but it's very, very widely used. And as you're preparing for interviews, you'll probably see this all over the place. So STAR stands for situation, task, action, result, reflection. And that's a nice way to just structure talking about any experience. Drafts. So you will not write your personal statement in one go, and that is absolutely fine. You shouldn't be writing your personal statement in one go. Do not be afraid to draft and redraft until you get it right. And that's get it right in terms of including the right things and getting it within the word count. Ask different people for their perspective. So we usually recommend that you ask 3 people to read over it and give you feedback. You don't want to ask too many people because then you're going to get conflicting advice and it's going to confuse everything. So we usually say a family member, a trusted adult, a teacher, and then if you have a Medics and Me mentor, if you're one of our partner schools, then you can ask your mentor. If not, that's fine. Find a third person who you trust and get some feedback from them. In order to say everything within the word count, you probably won't be able to say everything that you initially wanted to include, but that's okay. You just prioritize the most important things and you can still write a fantastic personal statement. And importantly, make sure that someone who is reading over it is checking for spelling and grammar mistakes. Because when you're writing, it can be easy to make a mistake and then not notice that when you're reading back over it, because you know what you're trying to say, but someone else reads over it, they'll be able to pick up on spelling and grammar mistakes. So that might be a teacher in your school that you ask to just proofread it. Then in terms of writing the conclusion, very similar principle to the introduction, short and sweet, and a very strong and definitive statement of why you want to study medicine. It should tie together what you've said without repeating a lot of things that you've already said. And I think the best way to show how to do this is through examples. So I'm going to share some examples with you now from our fantastic Medics and Me mentors and from their personal statements. So first example, my experiences have developed my understanding of a career in healthcare, reinforced my belief that medicine is the right path for me, and improved my interpersonal skills. I am aware that medicine is a vocation, and I am ready to make that commitment. Reapplying to medicine has strengthened my resilience, and I hope to learn more about myself as I study this dynamic, ever-changing field. That's a really strong conclusion. It's reflected on the different aspects that this person had talked about earlier on in their personal statement, but without repeating So they had talked about, as you can see, a few different things. It doesn't repeat in great detail, it just nicely ties it together. Another example, I possess strong leadership and communication skills, and I am confident, committed individual who can effectively manage my time and resources while enhancing a team. I look forward to the unlimited opportunities a medical degree offers. So really nicely tied together what they've said, and then looking towards the future and the opportunities that will be waiting for them in medical school and as a doctor. I have the resilience, work ethic, ambition, and drive to pursue a career in medicine and know that it is a profession in which I will excel and ultimately allow me to provide a positive impact on those who need help and the medical world. Another example, these worthwhile experiences have given me an insight into many of the NHS core values, such as respect and dignity for patients, improving lives, and working as a team, all of which will be required to optimise a patient's treatment alongside the multidisciplinary team to create client-focused care. My academic and career path to date demonstrate that I have the dedication to achieve, together with the commitment, energy, and desire for new challenges needed for a career in medicine, which is my passion. I believe my experiences and knowledge to date prepare me well in successfully pursuing this course at university and beyond. And then our final example, I believe my outgoing personality and excellent communication skills have allowed me to excel across multiple academic and extracurricular roles, enabling me to build rapport with people from diverse backgrounds. Given the opportunity, as a mature learner with exemplary interpersonal and problem-solving skills, I would thrive as a medical student. So what we're going to do now is look at some examples of extracts from personal statements. And what I want you to do with your pen and paper as I'm going through these is make a note of what these applicants did well, anything you think they can improve on, and as I said at the beginning, without copying anything directly, see what maybe you could do similarly in your personal statement if there's anything that stands out to you. And as with all of the examples in this presentation, they're all from current Medics and Me mentors, so people working with us who are medical students or not just foundation doctors anymore. We actually have doctors at all different stages of training. So, empathy is an essential trait required to provide high quality, patient-centered care. My listener volunteering role with Nightline was invaluable for evolving this skill, while responding to a diverse variety of concerns from the student population. It was crucial to be understanding and compassionate when discussing difficult personal circumstances. I believe I could apply these skills to be a reassuring presence for patients, building trust, and allowing them to feel heard and validated when addressing their concerns. So for anyone who doesn't know, Nightline is a listening service for students at university, and they're open throughout the night, so you can call and discuss anything going on that you want to talk about. So this person is talking about what they've learned from that experience. So they've really nicely said what the experience was, what they learned, and how they've related that back to how that's going to help them in the future, reassuring patients and building trust as a doctor. So that's a really well done reflection on an experience. In my own time, I volunteer within my school as a peer mentor. I aim to support and encourage the well-being of the younger students. Having suffered and overcome my own battles, I now work with the younger students to help those with bullying, self-esteem, friendship, and behavioural issues. Some students find it easier to confide in someone close to their age, but old enough to listen without judgment. I wanted to create vertical links throughout the school, making the process of moving up the school enjoyable instead of daunting. So this person has taken a really personal experience, showed resilience and shared that experience, and not only what they learned from it, but what action they took to help others. So they're showing fantastic personal qualities and traits there that a medical school will recognise as desirable. Next example, I believe that having a good work-life balance and avoiding burnout is critical to being a successful medical student and future doctor. I have demonstrated this commitment by attending and volunteering at parkrun events, allowing me to meet people from different backgrounds and achieve a healthy lifestyle. Additionally, I have learned conversationalist Spanish, key skill and hobby. This person has really nicely they're trying to demonstrate work-life balance, and they've demonstrated how they've done that, what they've learned from it, and they're demonstrating balance by mentioning other hobbies as well. They're conversationalist Spanish. Next example, I shadowed a neurosurgeon where it became apparent that their job requires excellent decision-making skills with clear, empathetic communication in order to reassure patients and their families while still treating them to the highest level of care. I believe that I have developed and perfected these skills through my role as a qualified fencing referee, especially as I work mostly with children who need referees to be understanding, patient, and professional. So this person has really nicely taken a work experience that they've had and then linked what they learned at the work experience to another example of how they've demonstrated what they observed. So they observed communication skills and work experience, then they've shown that they've demonstrated and developed their skills through being a qualified fencing referee, and then linked that again to being understanding patient and these personal traits and characteristics that are desirable for medical schools and that will be really helpful for this person going forward as a doctor and as a medical student. I have volunteered at school for children with a variety of learning difficulties. One student found pronouncing my name distressing, so I allowed him to rename me. He chose Richard. As minor as this sounds, it has allowed me to see a significant progression in his comprehension. I believe this shows I can conquer the challenges that a medical course offers, and I have the attributes to thrive at university and fulfill my potential. So this person has taken this experience they've had, and they've picked a really unique story from it and shared this really personal moment and connection that they had with a particular student. And they've developed this, so they've not just said that they volunteered at a school for children, they've picked a really particular moment, what they learned from it, and then linked that to their future medical career and how that's going to help them both in their job as a doctor and at university. So this is an example of someone who's talking about a book that they've read. So for anyone who hasn't got clinical work experience, wider reading on books can be a really good way of demonstrating insight into medicine, and it's obviously it's a lot more accessible than potentially looking for clinical work experience, which can be very difficult to get. So reading Being Mortal by Atul Gawande made me aware of the realities of medicine. He speaks of a case of an elderly patient suffering with incurable cancer being faced with the impossible choice between surgery or end-of-life care. Patient died after consenting to surgery, of which Gawande shares his regrets. This taught me that in this career we may be forced to make hard decisions that neither us nor the patient are absolutely satisfied with. This motivated me to do more research and complete an MOOC on palliative care, which highlighted the importance of dignity and respect in the incidence of patient death, and the fact that end-of-life care can be the most beneficial option for the patient, despite our strong desire to save their life. So that's a really nice reflection on the book that they've read, and then they've linked that to an experience to how they've further developed that skill in themselves, which really shows, wanting to improve yourself and make yourself the best that you can. So they've not just read the book and said, this skill is important. They've read it, shown why it's important, and then shown how they personally have tried to develop that skill. Shadowing a GP opened my eyes to the diversity of a career in medicine. My standalone memory of this experience was a female patient who presented with shortness of breath. Diagnosis of valve disease following rheumatic fever in childhood was made due to the GP's familiarity with the patient's history. From finding a murmur on examination to referral to a cardiothoracic surgeon, the succinct, honest communication by the GP explaining complex issues stands apart for me. It highlighted the empathetic and holistic approach needed in primary care. So this person has really effectively reflected on their work experience. They've stated what the experience was, picked a really particular moment without identifying the patient. They've taken an example of exactly what happened, so what they've learned from it and how that's relevant to a career in medicine. So what they've learned from that, the importance of empathy, communication, holistic care. So that's another really good reflection on work experience. I have always been active in college and school life. Being vice president in college, as well as a senior prefect in high school, taught me the art of responsibility and the positivity of teamwork and leadership. As a young ambassador, I was a student voice to make change possible, and as maths has always been a subject I adored, I have also volunteered as a maths tutor to students. It was a wonderful experience teaching me valuable skills such as how to teach and communicate effectively with different age groups. So this person has taken an experience they had in school, so this isn't an example of clinical work experience, but it's just as valuable because they've reflected really nicely on it. They've shown really good personal characteristics and traits that they've learned from this experience. And they're really clearly shown exactly what they learned from this experience. Working on a sheep farm for 5 years has taught me to be resilient, instinctive, and cope with death. I am entrusted to administer injections, drench and assist lambing for 4,000 ewes. I have learned to thoroughly examine sheep, diagnose and treat their diseases. I am aware of the strategies to deal with diseases, parasites, and the safeguarding of animals, and I'm able to see the science in practice. I am passionate about my work, and I believe I can use this in the journey through university. Because this is a really good example of a really unique experience that's going to stand out to the person reading the personal statement, because there definitely won't be many other people that can talk about that specific an experience like working on a sheep farm. So it's really good. They've taken a personal experience, they've shown exactly what they've learned from it, and then linked that crucially to medicine and to university and how that's going to make them a better student and doctor. As a problem solver, I have been successful in national computer programming Olympiads and collegiate competitions, independently supplementing my interest in science and mathematics. In the advanced stages, I was often the only girl in the room, which taught me to advocate for myself while working as part of a team. So again, that's reflecting on an experience and really nicely highlighting the traits that medical schools are looking for. So just to recap, considering everything that we've discussed, I want you to revisit the 5 traits that you wrote down earlier and think to yourself, are they relevant to a career in medicine? Do you have specific anecdotes and examples to demonstrate why you are suitable? And do you show reflection in these anecdotes of your experiences? And have a think about what you would change or what you would add to your personal statement if you've already started it. So thank you all very much for listening. I've got a QR code here for a feedback form, and everyone who fills in the feedback form will be entered into a giveaway for a free personal statement review from our Medics and Me mentors. As I mentioned at the start, in case anyone missed the very beginning, Medics and Me run loads of different events. So from virtual, we've got Meet the Doctors events coming up in the next few weeks. If you haven't had work experience, that would be a really good way to get an insight into the job of a doctor. But on our website, there is loads of information about all upcoming events and as well on social media. So as I said at the beginning, we're most active on Instagram and TikTok. So make sure you check those out. And the registration for all events will be on our website. So medicsandme.com if you want to register for any of our events. We'll have registration forms for all events on the website. I might just leave that up on my screen for another minute to give anyone a chance to scan the QR code or have a look at the website. But we'll take questions now. That's the end of the presentation. Okay, I'll stop sharing there, and we can start taking questions. And maybe Amy, if you want to share a link, that might be the best way to do it. So I'll start having a look through the questions. Perfect. So we've got a few questions initially on books. So yeah, books are a really good way to show insight into medicine. There are loads of books written by doctors and a lot of ones that there are plenty of lists of recommendations of those that I can run through as well. What books would you recommend to read? Yeah, so it is, as you said, it is very important to read around the topic that you're interested in. So in terms of books, I think if you look on the Medics and Me website, we've got lots of blog posts. So these are all written by both kind of medical students. There are some about specific experiences, and then about doctors. I'm pretty sure we have a TikTok about books to read. But if you have a Google online, there are lots of different. Personally, from my experience, I read This Is Going to Hurt. That was a really good one to give an insight into the work that junior doctors do, and it gives a good insight into the kind of less glamorous aspect of the job. It was written by someone who about their experiences as a junior doctor. So I read that one. I know one of the personal statements that I gave an example of read Being Mortal. So Being Mortal and When Breath Becomes Air are both kind of about, they're both written by doctors, again, about kind of more difficult experiences within medicine and dealing with death and things like that. But if you have a look online or have a Google for books that medical students should read, or books to read before applying to medicine, there's plenty of lists. Again, similar to talking about your experiences, like there's no right and wrong, there's no one specific book that you should read. Anything that you can give you an insight, anything that you can read that will kind of demonstrate to you the job of a doctor, or give you an insight into any aspect of the job, is absolutely worth reading. Books that I've read, as I mentioned there, one that I read and I think probably mentioned either in my personal statement or interviews, was This Is Going to Hurt. How do universities score interviews? That varies very much from university to university. Most of them will have on their website either a section of their website or a downloadable couple of pages of a PDF on how we pick our students, and that will usually be the best place to go. And in terms of how much do GCSE grades count, again, varies from university to university. So that would be part of your strategic application, and I don't know how much people will have heard about strategic application, but it's something that we really focus on with Medics and Me. Strategic application is about maximizing your chance of getting an interview. So that's having a look at, and if you check we've got both our TikTok and our website at the moment, we'll have focused things about that in the coming days and weeks, because it's the right time of the year for that. Some medical schools really focus on UCAT, some put a lot of weight on GCSEs, but there's different places to apply depending on what your strengths are. So you need to just apply to your strengths. And all medical schools will have on their website their specific requirements. But if you know that you have particularly a low UCAT, then we have like a TikTok of where to apply with like low, medium, high UCAT and things like that. So that would be my advice, because it does vary quite a lot from school to school. So I didn't do volunteering, work experience, hobbies. What can I do? So in terms of experience, that's absolutely fine. Like, not everyone can get volunteering experience or work experience, and that's fine. Medical students or medical schools even know that, and they don't expect everyone to have that. Reading books is a really good way to gain kind of an insight into the job of a doctor, or particular characteristics. And then I'd say if you can try from now to get even a virtual work experience, like Medics and Me are running a number of events that will be free and accessible to everyone. Meet the Doctor events, so they're kind of like hour-ish long webinars where we'll have a doctor come in, they'll talk for an hour and then take questions. And that can be something that you've mentioned in personal statement or interview about how you've gained insight into the work of a doctor and what it takes to get there. In terms of extracurriculars, and that can be absolutely anything that demonstrates desirable traits and characteristics. So teamwork, leadership, empathy, as we discussed, absolutely anything. And it doesn't have to be clinical, it doesn't have to be related to medicine. It could be as simple as one match that you played with your school, I don't know, basketball team. Absolutely anything. The most important thing with mentioning experiences is that you reflect on it. So you say what the experience was, what you learned, and then link that back. You know that's teamwork is a really important trait for a medical student and doctor to have as they work as part of the multidisciplinary team. So yeah, don't be worrying about it not being clinical. That's absolutely fine. Do you think it's worth mentioning that I did my dissertation on preterm birth and how to prevent it, or is it too early to say? No, absolutely worth mentioning. If that's something that you've explored and have a particular interest in, absolutely not too early to say. Because you don't want to come across as closed-minded. So I wouldn't say like to state that you absolutely definitely want to go into obs and gynae, but absolutely by all means mention that you've done that, because that's both showing that you have gone above and beyond to explore that interest, and it's showing that you're committed as well. So 100% mention it. Just don't come across as too close-minded, but definitely mention it because that's very worthwhile. Is it good to add an EPQ on the psychology of inner voice of our mind? Again, similarly, if you've done anything like that that can show that you have looked into and gone above and beyond, taken your time to explore a particular topic, and that can show passion, it can show dedication, it can show, you know, interest. Most important thing is that you link it back. So make sure you reflect on it. So if you're mentioning it, say what you learned from it and link that back to how that will make you a good medical student and doctor. Not getting in the first time round. Really, really common. Do not worry if you don't get in the first time round. That does not mean that you won't get in. So many of our mentors got in second, third time round. Do not worry if you don't get in first time round. That does not mean that you are not good enough. It does not mean that you won't get in next time. It just means that it didn't work out this time. But it will work out. If this is something that you want and that you're passionate about, you will absolutely get there. So not getting in the first time round is also a really good thing that you can use if you don't get in first time round, and if you decide to take a gap year and then work during the year and get some, maybe you manage to get some volunteering experience, or maybe you even get work that is relevant to working in healthcare. That can be a really good thing to use in your personal statement and then going on in your interviews, because not only are you demonstrating through your work that you're showing teamwork or whatever, you are demonstrating such resilience and such dedication to medicine. You didn't get in first time round, but that didn't stop you. You want this so much that you are going to try again until you get in. And that's actually, it can absolutely be a plus. And in terms of your application, you're standing out already for showing resilience and dedication to medicine by reapplying. If you don't get any interviews, can you only apply to another course the same year through clearing? If you get rejected from, let's say, pre-interview, so sorry, I'll start by saying with UCAS, there's 5, you have your 5 options, only 4 of those can be medicine. So your 5th option should be kind of in terms of courses, if there's another course that you want to do, that be your plan B for that year, if that's the route you're going down. But you can't, if you get rejected, as far as I'm aware, and anyone feel free to jump in and correct me here if I'm wrong, but if you get rejected pre-interview, as far as I'm aware, you can't change that to a different option. Then it would be either through clearing or your 5th choice. When should you start writing your personal statement? That's up to you, really. I mean, it depends on when you do the other parts of your application. So with the medicine application, because it's the early UCAS deadline, everything kind of tends to come together in a very short space of time that you have to have everything done. So you've got your UCAT that you'll need to have done by, I don't know the exact date, it's sometime around the end of September that you have to have that done by. And then you'll have to have sorted getting your references for UCAS, your personal statement, all of that UCAS stuff. There's kind of a 6-week period over summer and kind of start of the school year that's really, really busy. So I would say there's no such thing as too early. Like, get started as early as you can. But the main thing is just don't do it in one go. Don't leave it to the last minute. It's not something you want to be writing the day before that you have to submit your UCAS application. So if you can, try to do it over a couple of weeks so that you can have drafts. You can leave it and come back to it. You can have people read over it and give you feedback. But in terms of when you should start, there's no there's no right answer for that. There's no such thing as too early. Just don't let it. It's kind of easy to let it get forgotten about and become a bit of a lesser priority with UCAT. So the UCAT is the exam that you're going to have to do at some point over the summer or in September. So just make sure that you have your plan for all of the things that you have to do, because don't forget you're going to have to be balancing school as well. Like, you're going to be in if you're talking about reapplying, maybe you won't, maybe you'll be in uni or maybe you'll be working and that's a bit different. But if you're going into year 13, there's going to be a lot going on with school as well. So just don't leave it to the last minute. Make sure that you've planned ahead and you've got enough time to give to write in the personal statement, enough time to give to your UCAS preparation, and enough time for school so that you're not neglecting any of your schoolwork. Applying as a grad, how much time should you talk about your degree or experiences reapplying? As much as you, again, it's just about picking the right moments. So picking something, if you're talking about an experience within your degree, as long as you're showing what you learned and how that's relevant to medicine, then that's absolutely something that you should include. I think there's just an issue with the form being external users. I'll just double check that there, that it's set to external users being able to fill that in. Give me 2 seconds and I'll reshare the QR code then. If that's the case, that's people outside the organization can fill it in.
Do you want me to carry on with questions? If you have a
Yeah,
look
maybe
at
if you
that.
want to take that for a second and I'll just double check that that's set to
Brilliant.
um
So someone's asking, they had a baby at 24 weeks during my final year of uni. He was in the NICU for 5 months. Spent my time split between studying and looking after him in the hospital. What's the best way to mention this? So I'd say definitely important to mention this because that's, I mean, it's a really good personal reason why you want to apply for medicine. And as we were saying earlier, it's really all about saying why you personally want to study for medicine and not like a generic reason that lots of other people might mention. So you could say, I mean, it could even be your intro saying my exposure to healthcare when my child was in the NICU showed me how the MDT worked, showed me the impact it can have on families. Really, I mean, just say why it personally made you want to study medicine. But yeah, definitely really important to mention this. Yeah. As I'm applying as a grad, how much time should I spend talking about my degree or my experiences with reapplying? So I suppose it depends what your degree is in. So it's important to mention your degree in that you can link it to medicine if it's like a science degree, saying how the modules that you took perhaps sparked an interest in medicine or linking any extracurricular experience you had in your degree, any placement or anything with working as a doctor, and also the skills you learned during your degree and how that could help you cope with the rigor of studying medicine. I would say your experience with reapplying, you could link to resilience. So it's a really stressful experience reapplying. And I think that definitely helps you grow as a person. So you could mention it in that respect. But yeah, definitely really important to mention both. As they both, shape your journey for medicine.
I'm just going to reshare the QR code there. It should be accepting responses from everyone now, but we can keep going with questions while this is on the screen, just to give people a chance to get that feedback form. I'll just leave that up for a few minutes, even Amy, if you want to keep talking and going through the questions.
Okay, so yeah, our new QR code is just on the screen there, guys. So make sure you're filling in that one for lovely feedback. So I start my job as a HCA a few weeks after the UCAS deadline. So I still mention it in my personal statement that I'm going to start and will have a year of experience by the time. If I don't have any clinical experience since the last time I applied, is it still okay to mention other jobs that I've done since? So yeah, you can definitely say I'm going to be starting as a HCA. I wouldn't say I have clinical experience. Not to say that you would, but just make sure you're saying very clearly you're starting it in the future, just to make sure there's no mix-up at interview. Say if you haven't started yet and people ask you how it's going, you can say, well, I haven't quite started it yet. But definitely good to say that you're working as a HCA because even if you're not working as a doctor, HCAs are a really valued member of the MDT, and you can talk about how you learn how doctors interact with other healthcare professionals. Say you learn how to interact with patients, or the communication skills, working under pressure, teamwork skills, really valuable lessons that you can learn through working as a HCA. And even for people who don't have jobs in a hospital. So, I mean, I worked at McDonald's when I was applying for medicine, but I was still able to say I had teamwork, I worked under pressure, I balanced it with my revision. So it's all about those transferable skills that you can talk about in your personal statement. Since you only get to write one personal statement, how would that work out for your fifth option? So that's a really good question. So obviously you can only apply to your four, or maybe not obviously, you can only apply to four medical schools, and then your fifth choice has to be something else. I personally, I don't know if this is what other people who've got into medicine done. I didn't really mention my fifth. So I applied for biochemistry. I didn't talk about biochemistry at all for my fifth choice, because in my head I was never really going to do that course. I'd decided beforehand that if I didn't get in first time, I would take a year out and reapply. The only reason I did apply for biochemistry is my school suggested that I do it. So I would say if you're set on reapplying, if you don't get in after a year, don't worry too much about it. I can't really advise how you would work it in to your personal statement because I think you wouldn't want to talk about it too much and give the medical schools the idea that you're kind of considering other things. And also another degree isn't going to read it, and because you're not talking about their degree, so that's also not going to look good. So I'd say just focus on medicine for your personal statement. Is it worth mentioning MDT for dentistry? I'm not entirely sure about dentistry personal statements. I'm not sure if I'd be able to advise on that. I'm not sure if you've got any ideas on this, but I personally am not sure.
Yeah, I'm not too sure. I suppose even like within all healthcare settings, there's going to be an MDT involved. Like even applying for dentistry, you're going to have hygienists and assistants and nurses in that setting as well. So probably, I mean, I can't really speak from personal experience because I didn't apply for dentistry. Our mentors, we just kind of deal with medicine more specifically in terms of applications. But I mean, I would imagine it's no harm in mentioning it and in recognizing, you know, the team that goes into providing any kind of healthcare.
Yeah, definitely agree. I don't know if they use the term MDT in dentistry or if that's like specific to medicine.
Yeah, I'm not sure on that one
So
either.
yeah, so it might be best because I don't know if they do. You could just talk about teamwork or working with other healthcare teams, so like working with the hygienists or even with like reception and like administrative staff, talking about how you'd communicate with them under pressure, and how you'd use those teamwork skills. Yeah. So I think that's all the questions we have. Is it possible to get a link for the Google form just to pop in the chat?
Yep.
I can pop that on the
Yeah, I'll just
YouTube.
copy it from the pop that into the chat now.
Thank you. Just checking for any more questions. Someone's asked what grades do I need to get in GCSE and A levels for scholarship for Pearson Edexcel? I think that will depend on school to school. So probably
Yeah.
worth checking on university websites for specific details like that because it'll be different everywhere and there's so many, so it'd be too much to
Yeah,
go through.
absolutely. If there's any questions we've missed, feel free to highlight them, but I think that seems to be pretty much all of them.
Thank you so much for running that session. I'm sure everyone found it incredibly useful. We had lots of questions. I tried to answer as many of them as I could. Thank you very much.
Great stuff. Well, thank you.
Thank you. Thanks for coming, everyone. I hope you found it useful. And have a look at our